This morning, we're here to get an update on what's taking place throughout Bergen County and especially in the town of Teaneck. This morning, you're going to hear from the mayor of Teaneck, Mayor Mohammed Hamadiddin, City Manager Dean Kaczynski. You'll hear from myself in regards to what's happening in Bergen County. You're going to hear from Congressman Josh Gottheimer as to what's going on at the congressional level. And we're honored to have the CEO of Holy Name Hospital, Mike Marin, and the Chief Medical Officer from Holy Name Hospital, Adam Jarrett. I would like to take this opportunity to recognize those who are with us: Freeholder Joan Voss, Freeholder Director Mary Amoroso, Freeholder Steve Tonelli, and the Sheriff of Bergen County, Sheriff Anthony Curitin. At this time, I'm going to ask that the mayor and the city manager come up and address the public. Thank you.
Thank you, Jim. Good morning. From the moment the outbreak started in Westchester, Teaneck has been on the forefront of getting in front of the curve on treatment and informing our residents of the dangers of the coronavirus. We've had 3 conference calls with our township residents, and we had 2,000 people on the call. Since the outbreak, since our first patient came, I've been in touch with County Executive Jim Tedesco at least 3 times a day, as well as our management and our command staff has been in touch with the County Executive. I can't thank the County Executive enough for having all the resources and making those resources available to Teaneck. I think it's very important that during this time we speak with one voice and we have one person who is going to be in charge of what happens in Bergen County. And that person should be running through the County Executive, and our manager agrees, as well as our command staff agrees, that that's the way we're going to handle this. The next thing I will just say is that everybody is in support of the executive action that they were going to be taking care of. Everybody standing behind me. It's done with consultation with everybody who's standing here. And the last thing I want to say to the people in my town, the people in our county, in our state, in our country, we will only get through this together. We will only get through this if we depend on one another and we take care of one another and we look out for one another. With that, I'm going to give it over to my township manager, Dean Kaczynski.
Thank you, Mayor. I have a short statement I want to read first that will lead up to my executive order that involves an emergency declaration for the township of Teaneck. So just bear with me. The first statement, I just want to let everyone know what we're doing in Teaneck, and I'll go over the executive order shortly. Again, thank you, County Executive Tedesco, for your strong leadership throughout the crisis and making strong decisions to keep Bergen County safe. So thank you very much. As Township Manager for the second most populous municipality in Bergen County, I have an imperative to do everything possible to slow the spread of COVID-19 virus and protect those who are most vulnerable. This is a difficult and extraordinary situation for Teaneck. I recognize that people throughout the community, including our workforce, are concerned for their personal health and that of their families and friends. Teaneck currently has 18 residents who have returned presumptive positives for the COVID-19 virus, the most of any municipality in the state. I anticipate that number to quickly increase as each day passes. This does not include a number of residents under voluntary self-quarantine who may have had direct exposure to a presumptive positive patient. Not only has this virus affected residents, it has impacted my workforce. In an effort to protect all members of our community and workforce, especially those who present the highest risk for complications of the COVID-19 virus, I made several decisions as manager over the past week to prevent its spread. Some of these actions include canceling all senior and recreational sport activities at the Rota Center, canceling all municipal court sessions, closing of the Teaneck Public Library, canceling of all large events, postponing all non-essential meetings to include commissions and boards, reducing hours of operation to limit the exposure to our workforce, purchasing additional disinfectant supplies, and hiring additional maintenance staff to keep our buildings clean and sanitized. All employees have been briefed about the importance of using personal protective equipment and have been provided with a pandemic plan that provides information on how employees can protect themselves and their families from the virus. how to minimize the effects of a pandemic on employees and township residents served by township employees, and how to continue essential operations while meeting the service expectations of the township. My office continues to conduct daily briefings with staff and command, including our Office of Emergency Management, the last one taking place yesterday evening at 8 p.m. Communication continues on a regular basis with Teaneck School Superintendent Dr. Christopher Irving, officials from Holy Name Hospital, Holy Name Medical Center, let me correct myself, Mike, and our partners from Fairleigh Dickinson University, all of whom have provided excellent leadership and decision-making during this crisis. The Township's Health Department continues to work closely with county and state health officials to determine any further circulation of the virus within our community. The Township has held 2 community conferences calls over the past week, which allowed me to update our residents on the status of COVID-19 and to hear important information from members of council, other elected officials, and our healthcare professionals. We will continue to do so until this crisis is over. These are the prudent and responsible actions to take, which serves to educate the public on this virus and prevent further spread to the community and our workforce. However, in light of the recent spike of COVID-19 cases in Teaneck, I felt it necessary to take additional actions to safeguard our community. These were carefully thought out decisions and discussed at length with County Executive Tedesco, County OEM Coordinator Matt Tiedemann, Township Health Officer Ken Catter, Police Chief Glenn O'Reilly, Fire Chief Jordan Zaretsky, and Mayor Mohammed Hamiduddin. I realize the impact some of these decisions will have in the community, and I stand by them. They are not being made to alarm our community, but will further serve to safeguard our residents from the spread of the virus. I can't stress it enough, these actions will help save lives and further prevent the spread. In a moment, I will read Executive Order T 2020-01, which statutorily allows me as manager to make additional decisions to safeguard the community. This includes an emergency declaration signed by the mayor, as well as our OEM coordinator, Mr. Larry Robertson. Before I do so, the Township of Teaneck reminds all residents that the self-quarantine recommendation is one that is encouraged but completely voluntary. Residents are still allowed to travel to and from work. Residents who are able to work remotely from home should avail themselves to this option. The Township's objective during this time is to help flatten the curve of increasing cases of COVID-19 through self-quarantines and social distancing. I also want to announce that the municipal building located at 818 Teaneck Road and the Richard Rhoda Center located at 250 Colonial Court will be closed to the public effective tomorrow. Hours of operation for both facilities will now be Monday through Thursday between the hours of 8 a.m. and 4 p.m. I am encouraging our residents and customers to use the online services and forms to conduct business. Staff will be available during operating hours to provide customer service by telephone and email. The Township has created an email address that will allow residents to submit their questions and concerns about COVID-19, and the inquiries can be sent to covid19@teanecknj.gov. All questions will be answered by a member from our health department as quickly as possible. I also anticipate creating a COVID-19 hotline number that will allow residents to call by phone with their questions and concerns. That number will be released later this week. There are many moving parts to this virus, and information continues to change daily. While there is still much to learn about COVID-19, residents should remain calm and vigilant in their personal efforts to reduce the spread of COVID-19 and monitor the Township's website at www.teanecknj.gov for updated information. Teaneck is a wonderful community. Our residents remain strong and resilient. With continued leadership from our Teaneck Council, staff, and command, our county executive, and other elected officials, Congressman Gottheimer, thank you, we will get through this crisis together. As a reminder, the New Jersey Department of Health has established a 24-hour telephone hotline for residents who may have concerns or questions, and that number is 800-222-1222. At this time, I will read Executive Order T 2020-01, which outlines the purpose with and associated restrictions, which will remain in place until such time as it's determined by me that the emergency no longer exists. Just bear with me 1 second. I'm not going to read all of the emergency declaration, but I will start by saying that whereas in consultation with and at the recommendation of Township of Teaneck Emergency Management Coordinator Larry Robertson and Health Officer Ken Catter, the above recitals are incorporated herein. A health emergency hereby exists within the Township of Teaneck regarding the coronavirus, COVID-19. All necessary township departments are authorized to take appropriate action to assist in containing, preparing for, responding to, and recovering from the COVID-19 outbreak. All township departments immediately shall develop and implement any and all infectious disease guidelines and protocols and use all personal protective equipment in conjunction with the virus. All township employees shall follow all local, county, state, and federal health recommendations, in addition to Centers for Disease Control recommendations, including but not limited to hand washing, sanitizing, and basic infection control procedures. There is an immediate ban on all township business-related travel to any states that have reported COVID-19 cases. Similar travel restrictions are strongly recommended for all local travel as well. Township residents who are seniors, particularly those with underlying health conditions, are strongly encouraged to avoid large crowds and large gatherings while COVID-19 remains a threat. To combat COVID-19, the township shall be permitted whenever necessary to procure the necessary goods or services which are not available under contracts currently in existence with the township without complying with the New Jersey Public Contracts Law, including but not limited to the following: to award emergency contracts, including but not limited to emergency contracts or leases for relocation and support of township operations, for professional services, for purchase of commodities, services, and technology, to purchase food, supplies, services, and equipment, to procure any supplies or equipment required to ensure adequate sanitization, cleaning, or sterilization of any facility or location. The Township Health Officer shall implement any emergency regulations or amendments to any sanitary or health code of the Township. The Township Health Officer shall engage in periodic and regular communication with the County Health Officer in order to coordinate activities, avoid any gaps in information sharing, and collaborate on containment and mitigation measures in order to ensure accurate and comprehensive contact tracing to effectively combat the spread of COVID-19. Coordinate, communicate, and collaborate with all local health officials to take the necessary steps, again, to prevent the spread of the virus. All township departments shall take all reasonable measures to protect the health and safety of such vulnerable at-risk populations, including safe treatment, transfer, and discharge practices, and to comply with the Emergency Medical Treatment and Active Labor Act. The Township Health Officer and all township departments shall work collaboratively to determine and execute effective strategies, initiatives, protocols, and procedures to prevent and mitigate and combat the spread of COVID-19, particularly among the most vulnerable and at-risk populations, including but not limited to senior centers in town and nursing homes, and take action to the extent necessary to maintain the public health with respect to treatment or containment of persons with or possibly exposed to COVID-19. This order shall take effect immediately and shall remain in effect until such time as is determined by me that an emergency no longer exists. So that's the emergency declaration. I'm just going to go over a few bullet points here from the executive order. And this executive order, again, number T 2020-01, is pursuant to authority invested in me under the Council Manager Plan, New Jersey State Statute 40:69A-81, the Code of the Township of Teaneck. I issue the following executive order. Again, I'm not going to read it all. I'm going to read the most important sections here. Because of the escalation of the health emergency within the Township of Teaneck, County of Bergen, and the State of New Jersey regarding the coronavirus, COVID-19, the following places of public gathering, in addition to those set forth by County of Bergen Executive Order 2020-1A, are to cease operations due to the inability to provide appropriate social distancing in accordance with CDC guidelines. All bars, taverns, clubs, or other locations with plenary retail consumption licenses, all gymnasiums or health clubs, all daycare centers, all barbershops, hair salons, and nail salons, all private recreational sports programs which involve close physical contact, including but not limited to boxing, karate, taekwondo, basketball, soccer, and football. All places of public gatherings shall otherwise limit attendance at any event or gathering in order to comply with the CDC guidelines related to social distancing and the directive issued by the Governor of the State of New Jersey related to the gathering of people over 250. All restaurants, including those with the plenary retail consumption licenses, are permitted to serve takeout or delivery orders only. All township parks, playgrounds, basketball and tennis courts, along with recreational fields, including the Voti Park Sportsplex, are closed to the public until such time as it is determined by me that the emergency no longer exists. The following food chains located in the Township of Teaneck are to restrict entry to only one member of an individual family and to permit, at the most, the following number of customers on the premise at one time. We have Stop and Shop. There's going to be a limit of 50 patrons. Glad Express, there's going to be a limit of 25 patrons. Cedar Market, there's going to be a limit of 25 patrons. All houses of worship are strongly encouraged to temporarily suspend all services or other communal activities. All banking and other financial institutions practice social distancing and make every attempt to limit the number of customers. As to those restrictions set forth above in the following sections, the sections I just read, all appropriate township departments shall immediately enforce the above closure mandates in order to effectuate the terms of this executive order and shall immediately report any noncompliance to the office of the township manager. All workplaces are strongly encouraged to implement and observe CDC workplace social distancing measures, such as replacing in-person meetings while teleworking, modifying, postponing, or canceling mass gatherings. I recommend that all places of public gathering hosting 50 or more persons use their best efforts to record the name, address, phone, or other appropriate contact information for all employees, patrons, visitors, vendors, or any other persons within their facilities in order to aid health officials in the event contact tracing activities should become necessary in connection with their operations. All Township of Teaneck parking restrictions are lifted until such time as it is determined by me that the emergency no longer exists. Again, this is just for township parking ordinances. This is not for state violations. This order shall take effect immediately and shall remain in effect until such time as it's determined by me again that an emergency no longer exists. This executive order may be supplemented or amended as the COVID-19 health emergency continues in order to effectuate its purpose and terms set herein. So that's the emergency declaration, that's the executive order, and again, I think these are in place. Again, the ultimate goal for me is to keep my residents, my workforce safe, and this is a way that I feel it's the appropriate way to do it. I understand there's going to be inconveniences, but we have to get through this, and the only way for me to get through for our residents is as everyone comes together as a team. Thank you.
Thank you, Mr. City Manager. As the city manager and the mayor said, well, this is a local decision. It's not a countywide decision. When I met with the city manager and the mayor yesterday, along with the county OEM director, we talked about these things in great length. And I have to tell you that from a county standpoint, the things that you just heard, more than likely, in the next few days, will come to fruition throughout the county. And I say that from a preparation standpoint to the 1 million people that live here. That what the steps that TNEC are taking now, all residents should prepare themselves for these and more as the numbers increase. This is a model that we will use throughout the county. Well, the county plan goes further. We can only go so far to act in the general health, safety, and welfare of our residents. Individual towns will have to make their own decisions based on their own circumstances and the number of cases. And again, this is what I just talked about. TNEC, because of the large number right now, has to take different action than the rest of the 69 other communities here in the county. And as that happens, we will work with each one of those towns. This morning, let me talk about numbers. Yesterday, I reported 31 countywide. I'm not going to add to that number this morning because releasing the numbers, while I have new numbers, I've not shared, and the state has not shared with me, any of those numbers. And one of the things that we're trying to do is work in conjunction with the state and others to try to make sure that the numbers are accurate in both of our cases. I will tell you that's difficult. What I can tell you is, since I reported to you yesterday, we have more towns that the virus has spread to. And what does that mean? That means that this is getting bigger, and it's growing as we expected. And while I said to you earlier, that is why we need to plan, that is why we need to plan. 2 weeks ago, I stood here and held a press conference telling everyone that we were in a preparation mode and that should the coronavirus, COVID-19, break out here in Bergen County, we were prepared. 2 weeks ago. Little did I know the next day we would have the first case. Little did I know days later we'd have the first fatality. Little did I know that 2 weeks from then I'd be standing here having implemented steps to stop the spread of this virus, shutting down an entire 75 school district school system, 160,000 students, 16,000 educators, plus hundreds and hundreds of support staff. One of you standing out here asked me that day, County Executive, why are we going through this now? Do we really have to? Yes, we really have to. We are going to be prepared. I stand before you today to tell you we are prepared. We will continue to be prepared. But we're going to continue to take the actions that are necessary to protect the people of Bergen County. I do need to say one thing in regards to the numbers. Yesterday, when I announced those numbers, I inadvertently had my staff post the 2 new towns that had seen numbers. I had spoken to the governor's office and given him the updates. And after coming out of that meeting, I instructed my staff to update those numbers on the county website. In doing so, I put up information for a community where I had spoken to the mayor earlier in the day. I had spoken to Mayor Sarlo, who is the mayor of Woodridge, and he had said to me, we're gonna put a plan in place, and we're gonna discuss the information, and I'll get back to you. When I put that information up on the county website, we hadn't talked. And his community found out through me putting that up. And for that, I publicly want to say how sorry I am to the mayor and to the people of Woodridge. In this fluid and dynamic situation, I'm going to make mistakes. But I never would intentionally do something that I promised the mayor I wouldn't do. But I can't stand here and say I'm never going to make another mistake because things are happening so fast. So I stand here saying to the mayor of Woodridge and to the people of Woodridge, I'm sorry for the way this happened, but in talking to the mayor last night, he understands it. He said, Jimmy, you're doing a great job. Just keep doing what you're doing. We get it. So for that, I thank the mayor and the people of Woodridge for understanding what took place. I want to give you an update on county law enforcement here in the county. As you know, we have some concerns with the impact of county law enforcement. The other issue is in enforcing the regulations that I called for and the regulations that will continue to come forward. So yesterday I held a meeting with all of the county law enforcement officials, the prosecutor, the chief of detectives, the sheriff of Bergen County, the president of the Chiefs Association, some other chiefs, and the Attorney General is updated. And the County of Bergen has a plan in place. The Chiefs Association is working closely with the prosecutor, with the sheriff, to ensure that we have protection throughout the county and we can support our local municipal partners in the event that they need our help. As you heard the city manager say, he's trying to protect his workforce. All 70 mayors and police chiefs are trying to protect their workforce, and we know that this may affect the law enforcement community, but we want the people of Bergen County to know that they will be safe, they will be protected, and we do have a plan in place. The other update I want to give you is on the drive-through testing. Yesterday, the health commissioner announced at the meeting, at the update, that Bergen County will be the first location to do testing, drive-through testing. While I was pleased to hear that because I've been asking for the last few days to get some more testing, I want you to know that we're not near ready to roll it out. While I know she said that we hope to do it on Monday, I'm standing here today telling you logistically and others we're not going to be able to have it up and running on Monday. There's a lot of things that we need our help with, the medical community, the healthcare community, and others. We have logistics. We have the place we're going to do it. It'll be at Bergen Community College. And now I need to make the second apology. Yesterday, when the health commissioner announced that it was going to be at Bergen Community College, originally we had talked about doing it at Bergen Newbridge Medical Center on 89 acres. But when my OEM folks went there to take a quick look at it, and again, all these things are happening fluidly and quickly, he called me back and said, Jimmy, I don't think this is a good spot. I think we should use Bergen Community. They're closed. It's a much bigger area. I said, great, I agree. I then spoke to the commissioner 2 minutes before she walked into the press conference. I said to her, it's not Bergen Newbridge Medical Center, it's Bergen Community College. She said in the press conference, Bergen Community College. Unfortunately, I hadn't had the time to call the president of the college or the trustees. And they heard it from the health commissioner. And again, I have to say I'm sorry to Dr. Tony Ross and the members of the Bergen County Board of Trustees of the college, because they should have heard it from me first. And again, I'm going to make mistakes. I'm going to miss those kind of things. But at the end of the day, we have to make decisions quickly. And that was the change that was made quickly, and I didn't have an opportunity. So Dr. Ross, the members of the trustees, I apologize for not getting you that information before you heard it from the health commissioner. Last, let me say that the virus is real. When I put the restrictions in place to take other action, it is because people are getting very sick at some level, and some have already died. Emergency first responders fear for their lives. Doctors, nurses, and healthcare workers are putting their lives at risk every day to save our family members. So no, I don't take the actions that I did lightly. I know the extreme impact that they have on the people and business owners in Bergen County, but there is no other choice. When I receive phone calls, text messages, and emails from CEOs and business associates, advocates, telling me that those businesses should remain open, even with adjustments to their operations, not allowing them to remain open will cause them to go bankrupt and cause thousands of people to lose their jobs, yes, I understand those impacts. However, when I received the letter from an Esquire, signed Esquire, I really got the message. But let me be very clear. I will not change what I believe is the right thing to do. And what I am doing is saving lives of my fellow residents of Bergen County. We will continue to plan for what may be ahead. We all need to be ready to implement any additional measures which will continue to protect our residents, and we'll communicate those measures to you as we make further recommendations. As I said, this is real. We all need to be prepared to act quickly, our residents and business community alike. As an example of our business community coming together, the New York Giants has made a generous offer to provide financial assistance to those children who are food insecure. I would like to thank the New York Giants, the Mara family and the Tisch family, for their philanthropic actions in aiding us during this time of crisis. We will get through this with all of us being together, not acting against one another. We are Bergen strong. Now I'd like to ask Congressman Josh Gottheimer to give an update on what's happening at the congressional level.
Thanks. Thank you, Jim. Sorry. Thank you. Thank you, County Executive. Thank you, Sheriff, and our freeholders, and Dr. Marin, Dr. Jarrett. Thank you so much for your leadership at Holy Name Medical Center. I know that residents throughout our communities in North Jersey, and especially in Teaneck, are on high alert. And I truly appreciate everything that is being done here on the ground and across my district in every county. From the residents who are self-quarantining to the excellent leadership from our state, county, and local officials, our hospitals and our first responders, as Jimmy said, who are especially in harm's way, and all of our frontline healthcare workers, our doctors, our nurses, and lab technicians. I want to thank the mayor of Teaneck, the deputy mayor, the township council, and Bergen County Executive James Tedesco for their superb leadership and for helping make sure we take the proper steps to curb the spread of the virus. The self-quarantining in Teaneck and the decision to close our schools will help mitigate the spread of the virus. These proactive measures will help stem the rising tide of the virus. Given the shortage of tests, we must do everything we can to contain the coronavirus. I also encourage everyone who are not self-quarantining to practice smart social distancing. No handshakes, no large group meetings, no hugging, and telework, and to ensure that you telework wherever possible. And as Jim will tell you, I'm a hugger, so this one's particularly hard. But we all have to make sure we do the necessary things to contain the spread of the virus. Right now, more than ever, we must come together as a community and as a country. This virus doesn't see gender, religion, race, or political party. We are all in this together. Now is not the time to look backward, it's the time to look forward and to take the appropriate measures to stem the virus and solve the problem. I want to recognize those who've stepped up, including the continued coordination between our hospital and providers throughout North Jersey. And I really want to thank Holy Name for your leadership. Those working to ensure our medical professionals have the supplies they need. And our teachers, superintendents, and parents for ensuring that our children will still get a great education while our schools are closed. On the national level, 10 days ago, the House passed its first bipartisan emergency legislation to invest in robust response to the crisis. This included support for state and local agencies, vaccine and treatment development, and loans for affected small businesses. That bipartisan bill was then passed by the Senate and signed into law by the President. Then, very early Saturday morning, after working closely with Democrats and Republicans in both chambers and with the administration, the House of Representatives passed a second bipartisan bill to continue addressing the coronavirus, to keep families across our country safe, and to help address the economic impact. This bipartisan legislation provides coronavirus testing free of charge to all patients, emergency leave with 2 weeks of paid sick leave, up to 3 months of paid family and medical leave, enhanced unemployment insurance to protect furloughed workers, increased federal investment to help state and local governments and health systems respond to the virus, and strengthen food security programs for children, school, students, seniors, and food banks. This includes investment in meeting increased demand at local food banks, additional investment to deliver meals to seniors who may be homebound, and we're helping school-age children continue to receive free meals even if they're not in school. And I know this is something that Jimmy and others and all of our communities are working very closely on. And I spoke to the county superintendent yesterday, and I know that you're working closely with him to make sure that happens in all of our schools. It's also been the same conversation I've had with the counties of Sussex and Warren and Passaic. And it goes without saying that we must get more people tested. Not just swab, but get the results back, and much faster than the current multi-day turnaround time. Something we've spoken about quite a bit, and I know something that the country is working very hard on. We are obviously far behind in that regard, but I'm hoping we'll catch up in the coming days and weeks. In the meantime, it's why self-quarantining is so important. Because as we wait for these test results, we have to make sure we stop the spread. The United States Senate will be voting on the legislation I just discussed earlier this week, and the President has indicated that he will sign it into law straight away. We must also address the economic impact of the virus on all our businesses. Not only those in tourism, like the airlines, but all those small and medium-sized businesses that are dealing with a massive slowdown. Extreme health measures will require extreme economic measures. I'm hoping that the paid leave and enhanced unemployment we just passed will help. And we've asked the IRS to delay this year's tax filing dates for businesses and for individuals. But I know the virus is affecting a lot of jobs, especially for hourly and gig workers. And we need to keep people employed in this moment and help our businesses stay afloat. Many of us in Congress are already working hard on proposed bipartisan legislative measures. Finally, I will continue to be in touch with our hospital executives and chief medical officers all across the 5th Congressional District about what resources they need. Obviously here in Bergen County, but in all 4 counties that I represent. I know you are all constrained, and I'm in touch with the administration and the governor's office to figure out how to access reserves of masks, gowns, goggles, swabs, and other materials that you need. Just yesterday, the New Jersey Department of Health received and distributed 13,000 gloves, 4,500 masks, 2,200 face shields, and 1,400 gowns. This is a helpful start, but our hospitals and frontline healthcare workers need much more of these supplies, and they need them fast. I'm sure Mike and Dr. Jarrett will talk about that in a minute. Our local hospitals and health departments need additional access to the strategic national stockpile of reserve medical supplies. And many of us have been in touch with the administration, including as early as this morning. We also have to help ensure that our frontline healthcare workers stay healthy. They're working around the clock, as we've heard, and they're exposed, and many have been quarantined. They need to have these protective supplies and protective gear. That's why we must work very hard to make sure they get them. And I really commend the hospitals for working so closely together. All the hospitals in my district have been talking to each other every single day to help one another. It's exactly the kind of thing we should be doing, and I commend them for their cooperation. With the declaration of a national state of emergency, I'm hoping for greater flexibility at the national, state, and local level, including tapping into a reserve of federal disaster investment from FEMA. FEMA can help our local communities respond to this crisis by assisting with transportation needs, mobile medical units, and logistical support. I'm also calling on the administration to activate the U.S. Public Health Service strike team to help assist Teaneck and other areas in North Jersey that have been hit particularly hard. The Public Health Service strike team has served on the front lines of other major public health crises, including Ebola, Zika, and SARS, and I believe they can help us here, and I've asked them to do so. All of these steps are incredibly important. They're vital to keeping our residents safe. These are trying times, but I know that here in the greatest country in the world, we are stronger when we all come together, as one Bergen, as one Teaneck, as one New Jersey, and as one nation under God. So stay healthy, stay safe, and please continue to take into consideration the health and safety of all those around you. May God bless all of you, and may God continue to watch over our great country, the greatest country in the world. Thank you, and God bless you.
Thank you, Congressman. Now it's my honor to introduce a friend, someone that is the CEO of Holy Name Medical Center, that is in the front line of what is happening as we stand here today with COVID-19. Their hospital is seeing more patients than any other hospital, I believe, in the state of New Jersey, and they're doing a damn good job, but they need help. And I've had the opportunity to speak not only with Mike and his chief medical officer, but I've also had the opportunity to speak with all the CEOs of the hospitals here in Bergen County. We'll continue to have that dialogue, but having a guy like Mike Myron here to talk to you and to talk to us about what's taking place on the front line is an honor. Let me introduce the CEO of Holy Name Medical Center, Mike Myron.
Good morning. Thank you, County Executive. I appreciate it very much. Let me start by just giving you a quote from Martin Luther King. He once said that the true measure of a person does not come in times of comfort and convenience. The true measure of a person comes in times of conflict and difference. We are in one of those times. I want to thank the County Executive. I want to thank the Mayor and the Township Manager. I want to thank Congressman Gottheimer, who has been out in front. I want to thank Governor Murphy and Commissioner of Health Persa Kelly. It pains me to hear County Executive stand here and apologize. These are trying times. We are all going to make mistakes. There is no reason for that. We all have to have a greater tolerance and a greater understanding and appreciation for what's going on. I assure you, these gentlemen have all stepped up in extraordinary ways, and we should be extremely proud of the effort that they are putting into trying to get ahead of this. It is unprecedented, and so we are confident in that response. Let me just give a couple of insights into testing and what it is and what it's not. I want to reassure everybody, just so you know, because this is not said enough. Testing is purely for educational purposes. We are trying to learn as fast as we can. There is no treatment differentiation if you're tested and come back positive, because there is no treatment, right? So there is some compassionate use modalities that Dr. Jarrett can talk about that we're starting to deploy, but there is no specific treatment. Testing is vital to education. People want to criticize the CDC. You should not. They have their proven methods of learning. You want to criticize the Department of Health. You should not. They have their proven methods of learning. We may not agree with them, but they are proven, tried and true over time. What we are doing at Holy Name, given the volume and the pace that we are faced, is we have injected our own learning methodology to teach our practitioners to learn to see if we can get ahead of this disease. It is a critical point, right? So I don't want the public thinking that all of a sudden testing is going to allow them access to something that doesn't exist. I also want you to know that at Holy Name, we have treated, and so any testing that does take place absolutely has to be coupled with robust monitoring. And what I mean about robust monitoring, that is screening before the test is taken. Are you symptomatic, asymptomatic? If you're asymptomatic, or you're in close contact with a known, confirmed positive case, right? There's criteria. If you just think you have a cold, that is not a good symptom, and you shouldn't just show up for testing. There's a high degree of self-responsibility that we have to call upon here during these times, right? So it is critical that people understand that testing without robust monitoring, so screening beforehand, but screening and monitoring after, okay? We have tested 117 people at Holy Name so far, and that number's growing every day. 58 of them are symptomatic. Of the 58 that are symptomatic, 7 came back negative. We don't know that that's true. They're symptomatic. They were not confirmed with any other disease. We have to continue to robustly monitor them. If we told them, hey, your test came back negative, and their response is, great, I'm clear, I can go about my life, I don't have to follow any of the social distancing rules that everybody's asking for because I'm negative, that's wrong, because they could turn positive very quickly several days from now. And so it is critical that every test that is done is coupled with pre-screening and follow-up monitoring, right? Essential. I can't stress that enough. It's very, very important. The other problem we have is, as of today, and this is a very, very fluid situation, as County Executive Tedesco said, there are only 3 labs available to test. There is the CDC, which has a very, very slow turnaround time. It's about 9 days, right? So I have samples that we sent there over 9 days ago. I still don't have an answer, right? The Department of Health, same. They're inundated. It's very slow. And then there's LabCorp. Quest is not online yet. The CEO is a good friend. He thought he would be online this week. He's shooting for next week, right? Other reference labs are not online yet. Hackensack, who has been very supportive of us, they sent over a whole bunch of PPE equipment yesterday when we were running low, and I appreciate that gesture very, very much. They designed their own testing, but it's very, very limited. And Hackensack's a smart organization, so they're going to do their own learning module. That's a good thing. You don't want us all following the same learning model. You want variation here so that we get a better handle on it. That's what we're advocating for, all right? So our whole approach today is to push that through. When we follow and report with the numbers, there's going to be errors, right? So of the 58 symptomatic people, 7 are negative. That's a potential 12% false negative rate, because we don't know what those 7 people really have, right? So it's possible they have it, it's just that the test didn't detect it. We have to assume that, why we have them on still isolation, very, very close monitoring. The other is we report around the numbers and around the lab results, but I can tell you right now there are 6 people in our ICU on ventilators. 3 of them we've gotten lab results back for, so we know they're positive. 3 we haven't gotten the lab results back, because we don't know that they're positive. So we don't count them in the confirmed positive case. But I assure you, my clinicians are saying, we know what this is, that's coming back positive, they're on a ventilator in the ICU. So again, it's time, it's pace, it's movement. And so that's what we're trying to do. I don't want anybody, during this very, very trying time to go out above and beyond and criticize. It is not appropriate, it is not helpful. The stress levels are at an all-time high, I get it. The fear in the community is at an all-time high, I get it. But I tell you, as Martin Luther King, the best of men have risen here. They are responding in an extraordinary way, and we should all be very, very proud and very diligent. Dr. Jack?
Excellent.
So thanks for giving me a couple minutes just to talk about what's going on the front lines. First of all, I wanted to thank my medical staff and the nursing staff and technicians at Holy Name. They are really the people that are putting themselves at risk on a day-to-day basis, and they're doing it in an incredible way. Unfortunately, because caring for patients is not a perfect science, and because patients are presenting with atypical symptoms, and because we have problems with capacity and staffing, we have put our staff, and every hospital in the country has put their staffs at more risk than they would like them to be. We are following the most stringent CDC guidelines, and we've still had to furlough well over 25 to 30 staff members, and I believe we will continue to have to furlough. We are doing that because we believe that every time you prevent an infection, you save a life. Now, I want to clarify that. Not every patient who gets infected is going to succumb to this disease. In fact, the vast majority will not. The vast majority of people who have this disease are going to be fine. In fact, that is what is so dangerous about this disease as compared to Ebola. The vast majority of people who get this disease may be minimally symptomatic or feel like they have mild to moderate flu symptoms. The problem is one person infects two, two infects four, four infects eight, and so forth. So therefore, every time we prevent an infection, we stop that chain. And every time we stop that chain, we save a life. That is crucial. I strongly encourage the action that you are taking and the continued action that we go to self-isolation and possibly quarantine. Every time you prevent a person from getting infected, I am not worried about that individual. I am worried about the chain of people that they are impacting. So at Holy Name, we have 6 patients in the ICU right now. We believe they're all positive. As Mike said, we are not relying on the testing. Our clinicians are using their judgment. We have 2 positives in our emergency department. We are using our emergency department as a staging area for all possible coronavirus patients. We have an additional, it changes every minute. When I checked several hours ago, 10 patients in the emergency department. We've had up to 16 patients in the emergency department at any time. We are sending as many patients home as possible. The vast majority of people can be managed at home with careful telemedicine follow-up, and that is crucial. I am imploring the people of Bergen County and the people around the country to hear that. You need to talk to your clinicians. You need to stay in touch with them, and then you need to stay home. And when you do get care, you need to be forthright and honest about your exposures, because every time you don't do that, you are putting other people at risk. Thank you.
Let me just tell you that when I didn't give you any numbers this morning, when I did get the call about what's going on in the county, one of the hospitals in the county had, at one time, 5 people that they were treating. They sent 3 of the 5 home for monitoring. This morning when I got the call, they now have 5 people back. The 3 people that they sent home to monitor, their conditions worsened, and they're now back in that hospital. And that just goes to the point that Mike and Adam were talking about, that with close monitoring, we can effectively manage this. But here we had 3 people that went home thinking, well, let's hope that they can get through this on their own. That changed. So when I got the hospital report this morning, because I get a hospital report, all the hospitals have been great in allowing us to get information from them. Last night when I went to bed, that hospital had 2. When I woke up this morning, it was back up to 5. So that's how things change and how rapidly they change. So you've heard from a lot, you heard a lot today, and you heard from a lot of people. Our job is to get the information out to you as best we can so that you can make decisions for yourselves and your family. But we need to have your help and cooperation. People have to understand this is real. This is real. And as the doctor said, we should be self-isolating, self-containing. We can help stop this. If we don't, what you just heard from 2 hospital officials at the front line, they're managing it right now. I don't know that I can stand here a week from now with them saying we're managing it without everybody's help. So let me take some questions. Yes.
County Executive, can you share with us the other towns in Bergen County where you said there are positive cases? Obviously, you have to understand there is a high public interest in that, especially naming, considering Teaneck is now under a self-quarantine. And do you foresee that measure in some of these other towns that have positive cases?
So I'm not going to make the mistake I made yesterday by saying a town that's not on the list until I've had conversations with those folks and they're comfortable with either me putting it out or them. So I'm not going to make that mistake again.
But you do understand the public concern.
Absolutely, 100%. And when it's appropriate for me to put it out, I will. But let me answer. So if that town gets 1 positive, right, they don't have any right now. Those couple towns are going to get there first. That's not going to change, really, from my perspective, the county, what we're going to do with the county. What makes me nervous is when we go from 8 to 18 in one day. And I don't have the numbers for TNEC yet today, but I'll tell you it's not going to be 18. I can guarantee you that. I'm hoping that it's not 28 or 38. So the numbers play a role in our trying to make decisions. So the decision we made is because of the big jump in TNEC, we have to go to a different level. But that was, we were able to do that just from TNEC standpoint. Today, if Englewood or another town goes from 13 to 23, I'm going to be having the same conversation with Mayor Wiles in Englewood or anywhere else. Now, if those numbers start to spread, which now we're finding, right, new towns, so one here, one there, that's where I'm starting to get concerned countywide, that I'm going to have to take more drastic steps than I took before in regards to the spread. So that's how the numbers play a role in our thinking and our planning. So numbers are important, but they're important to the point where it helps you make decisions. Whether TNEC has 18 today or 19, or the state has 16 and I have 18 or 19, that's not so critical to me. It's critical to the people, but to me, I know what I'm doing based on those incremental increases quickly. And that's why the information for me, getting it from the hospitals on a quick time, real-time basis, that's the frustration you've all heard me have for 2 weeks. The local health officers, you got to get me the information. You got to get me the information. Now we're because of the cooperation we have on the hospital side, we're actually getting that information real time.
Just so that viewers and the residents in Bergen County can again manage their anxiety and their fears.
Sure.
What kind of time frame do you anticipate having where you might be able to provide the towns or the municipalities on a more regular basis? For example, the first case was in Fort Lee. We were able to learn about that, but there may be people in Paramus or Lodi or Hasbrook Heights who are concerned. So is there maybe a time frame under which people can have an expectation to get that information?
I'm gonna let Mike try to take a shot at that, and then I have something.
It's a great question, but I got to stress this again. Just because a town doesn't have a confirmed positive case is not a reason to be aggressive in their social distancing and restrictions of group socialization within the town. If that town never gets a case, guess what? We won. To wait until there is a confirmed case to ramp up, it's too late. So where you are in the town right now really doesn't matter, right? It's not you need to be aggressive ahead of it. That's what we're trying to tell people. If we're chasing this because we're going to be liberal, I know self-sacrifice is not a common theme these days, but that's what's required. And if people are willing to do it, we can get ahead of this and mitigate it very, very quickly, and hopefully it'll go away very, very fast. But if we wait to respond with aggressive measures only once there's confirmed cases, it's too late.
And you and I have talked back and forth during the week, and certainly I want to get the information to the mayors and to those folks as quickly as possible, no doubt. But the point that Mike's trying to make, and I've tried to make all week, is when I tell you that you have one or two, all I'm telling you is there's now somebody, but you should have been planning all the way along that you already have that, right? Because somewhere in that community, a person is positive going through that community. All it depends on is whether that person stopped somewhere and had the exposure to somebody else that picked it up. But I guarantee you, in all 70 towns in this county, there's somebody walking through that town today that is positive. He or she may not be showing it, but they're positive. And what I'm trying to say to everybody is, don't wait. Don't wait. Do the social distancing. Don't wait until I call you to say you got a case. Be ready, be prepared, be out there educating. And I have to say, that the 70 mayors that I had a conference call with, they all get it. On Tuesday, I'll have another one. We may be in a different position where I am today, standing here telling you that I may be instituting more measures. What I'm saying to them right here today, be ready for that. Be ready for that.
County Executive?
Sure.
I'm just confused over one thing. Are you anticipating a self-quarantine order for the entire county?
So, right now, I believe that I have a plan in place that before I would take that action, there are other steps and means that I believe we could put in place to continue to help slow the spread with the cooperation of the municipalities, the leaders, but mostly the understanding of the business community, because that's where we are now, right? I'm outside of the government, the government entities, right? We did all the things we needed to do, shutting the government entities down. Mostly everything is shut down, both at a local and a county level. You know, I went into the business community with the movie theaters, the dance halls, the performing arts centers, and all that. You heard what is now going to take place in Teaneck. I would envision, given what I know today and what I may know tomorrow, don't be surprised if I go to the next level of asking the businesses and the community at large to take other actions. Anyone else?
I do have a question for Mayor and Mr. Mayor and the town,
Keith,
town
why don't-
manager. Last night when the request was made for the self-quarantine, we spoke with the two of you via video, but we see you here today. Should you be self-quarantining yourself since you are residents of the town, both for the mayor and the city manager?
I think the way this is transmitted, I think that, there's kind of confusion. So I'd like to have, if you want to get in here and talk about how it's transmitted, just because we're all in the same room like this and you're walking through Teaneck, that doesn't mean that, like Teaneck is the epicenter of the disease. And when I say epicenter or ground zero, we are ground zero and epicenter in clinical and how we are going to combat this virus. So if you want to talk about how it's spread.
So we're not going to be able to stop this disease. This disease is out there, and it's going to continue. What we need to do is limit spread every time we prevent one case. So the recommendation is social distancing. We should be standing farther apart from each other. You should all be farther apart from each other. I'm doing that with my family, with my friends. We all should be farther apart from each other. We can't stop doing what we need to do. This group made the decision that communicating with you warranted us getting together. But yes, this is not ideal. But the benefit of communicating with you outweigh the risks of the potential that we're all putting each other at and the people we're in contact with. But yes, at Holy Name, we've eliminated all meetings. The only meetings we have are small groups in large rooms, or we're doing it via telemonitoring. Everyone should work at home. The less we are in contact with each other, the better. Many of us in this room are going to get this disease. That is just the reality. I don't mean to scare you. Most of you, hopefully all of you, will be fine. But if we can limit how many of you get this disease by social distancing, we're going to save lives.
Just to follow up on that, can you explain the furlough? Is that furlough because they are in self-quarantine or furlough to limit exposure? Can you explain?
So we are following the CDC guidelines that any clinician who is in contact with a patient within 6 feet for more than 2 to 3 minutes is being tested and furloughed.
And also, what about your elective surgery? Is that on hold?
We have begun to make moves on a case-by-case basis to to reschedule and postpone elective surgeries, as all hospitals and healthcare facilities should be doing.
Excuse me, all of this is obviously lots of anxiety happening right now, not just here, but across the globe. Anything comforting or positive that you can tell residents at this point?
Yes, that the vast majority of people who get this illness are going to be fine. In fact, most scientists think children have this and it has minimal impact on them. So the reassuring part of this is the vast majority of us who get this are going to be fine. We still need to figure out the science as to why some people get more sick than others. We do know that if you're in the vulnerable population, if you're older, if you have comorbidities, that is a problem. That is specifically the population that needs to self-distance from each other. But the reassuring component of this is that the vast majority of people who get this will be fine. I don't want to say this is like the flu. I don't know yet. But we don't panic about flu season every year. But 20 to 40,000 Americans die of flu every single year. That's a terrible thing, and we don't panic over that. Is this going to be the same as that? Slightly worse, slightly better? We don't know. But if we think of this as a new flu bug that is potentially more dangerous, potentially less dangerous, then we should calm down. And we should do what needs to be done, which is don't infect your family, your friends, and your neighbors. Assume that you're putting people at risk when you're close to them.
For Congressman, I'm sorry.
No, go ahead.
For the Congressman?
I think there's
Go ahead.
confusion out there about what they do if they think they have the illness and at what point they need to go for testing.
Yep. So I am encouraging all people, people who potentially think they are sick, to be in contact with their primary care physician. At Holy Name, we set up a telemedicine line that individual physicians can reach out to when they have questions about their patients. So if you have majority of people who will reach out to their primary care physician will be told, go home and self-isolate. Take some Tylenol, drink lots of fluids, do what you would do if you had the flu. If patients have more concerning symptoms, for the Holy Name community, they will be brought for outpatient testing in an area that we've arranged for. And if patients have even further concerning symptoms, they will be evaluated. They should be evaluated in an emergency department. Physicians should not be testing patients in their office, even if they have access to testing equipment. This is tricky. This is not testing for the flu. It is simple to test for the flu. When you test for the flu, the chance of spreading the virus is almost zero. When you test for coronavirus, you are potentially putting yourself and your staff at risk by testing for the virus. So this should be tested either in negative pressure rooms or, if negative pressure rooms aren't available, outside.
Congressman Geisenheimer.
Yes.
This morning, Governor Cuomo criticized the House bill, saying that it did not take under consideration where the highest number of cases are geographically in the country, and suggesting that more funds should be allocated to New York and perhaps New Jersey, and specifically New York. Can you please respond to his comments and criticisms that that was not taken under consideration? And then secondly, can you talk about how you see the process moving forward in the Senate tomorrow?
Sure. I didn't see his comments specifically, so I can't directly address them, but I'll tell you that I believe the House measure was a critical measure in making sure that we, from both a testing perspective and a paid leave perspective, and of course taking care of our seniors and our kids, making sure that no one goes hungry, very important. I think there are more measures that we're going to have to take. Keep in mind, just 2 weeks ago, we passed bipartisan legislation for $8.3 billion in emergency aid to help with our states and our counties to get those dollars out, and we're doing that, and we're working very closely with the states to do so, including working with, of course, New York, but New Jersey, which I'm focused on, the 5th District, making sure we get these resources back here. And I think, obviously, you're going to see more resources going to the hot zones. And I think that's important. That's something that I'm stressing, something that's why I've been in touch with the administration directly about this, to make sure we get the resources back here where we need them immediately, and we'll continue to do that. I think the Senate will pass this, in my understanding from talking to senators, this will get passed quickly this week. The President has said he'll sign it into law. I don't think this will be the end of what we need to do. I mentioned economic measures we're going to have to take. And also, it's a fluid situation, as was said. You know, we have to see what's needed, and we're going to have to respond on the federal level. And I'll tell you, talking to my colleagues, Democrats and Republicans, we're all prepared for that, and we understand the importance right now of working together to get this done. This is the moment where we really need to come together as a country. I cannot stress that enough. This is not a time for politics. This is a time to put country and make sure we put everything, the United States first, and taking care of people first, and enough with the screaming and yelling, just get things done for people. Thank you.
Anyone else?
Yes.
Sure.
I wonder if someone could address, do we know anything about this particular virus in Teaneck? Is it centered in a particular community as it was in Rochelle? Or can anyone speak to that at all? We supposedly have a large number of victims in Teaneck. Are they centered in any one place?
So we know originally there was a linkage to New Rochelle.
There was.
We know. Can I describe the exact? No, I can't. But we know that. We know that. We also know that we have a doctor in St. Joe's Hospital that lived in Teaneck that was very active in his community. He was very active in the community at large, so well known. And we also know that he was very active in his religious community.
Talking about Dr. Cruz.
Yes. and a man that was very active in the emergency response community. So we're able to, without getting names and addresses of people, we're able to look at it from a community-based standpoint and say, we know there was a linkage between New Rochelle and Teaneck, and we know there's linkage between Dr. Pruitt and the doctor from Teaneck and where he worked and then where he visited. So yes, we know that we have it in the Orthodox community. We know we have it in the African American community. But to be honest with you, it's in every community, every ethnic background, every religious background in Teaneck. So while we can tie it to two, it's in every background. And so we're not getting hung up from a standpoint of the Orthodox community, African American community. We're looking at it from a community-wide issue and basis, saying what are we going to do to protect all 41,000 of the people.
And Jim, I think nationally to make this point also that it's not in
Anyway, right.
Because, right,
It's all over.
It's all over.
Right.
I just want to thank you for your time, because I know you guys are
Yep.
exhausted, and we have lots of questions, but these are questions from the residents here in Bergen County. Two more really quick questions. First, can you give us an update on the drive-through testing center that's going to be opening in Paramus? I think people want to understand how that's going to work, how that's going to be prioritized. And secondly, in light of the self-quarantine and Teaneck and what we're hearing about the numbers here in Bergen County, can you also put that in perspective for people who are flooding the grocery stores, fighting over toilet paper, getting arrested over these things? Should we be fighting over coffee creamer and
No.
chicken? You know, like, it's a little too out of control.
So,
those are my last two questions.
so the answer to your second question is no, we shouldn't be, right? We should be using common sense about this, right? We shouldn't. The virus isn't taking the food away from us, right? It's not affecting our food supply and our food source and things like that. What it's doing is it's making people act irrationally or acting that they don't normally act like. Yesterday I was in the store and I was looking for toilet paper, and all of a sudden, we come out with 2 rolls, and I'm looking at it and it says recycled toilet paper. I'm like, recycled toilet paper? No, it was recycled paper. But that's what was on the shelves. So no, people shouldn't be doing that. In regards to the testing, I did talk to the health commissioner again this morning and last night. I know she wanted to say, she said yesterday it'll be up and running on Monday. It won't. We have a lot of work to do, and certainly Mike and Adam helped me today understand how critical and difficult it is to set this up. We're hoping to get it set up. We're hoping to do it right. That's what they made me understand. You got to do it right. And so I'm just the doer, right? I don't have the medical side. I can get the physical location set up. I can get all the pieces put together. But when it comes to the medical component, I need the experts. They're the experts. They offer to help us. I'm taking them up on that offer. So sometime during the week, next week, I'm hoping that we can announce. But what it'll be is there'll be front-end screening by telemed, right? So you'll call in. You'll be screened over the phone by a qualified person. That information will be gathered. It'll be reviewed by a physician. If the physician says yes, add it to the standing order to be done, that person will be given a date and a time, and then that person will come that day to be swabbed, and then the swabs will be picked up by a company. They'll take them to the labs, they'll do it, and we'll get the results back. The beauty of this is we've been able to, at least the health commissioner tells me, that the negotiations that they're having is that the information will be given back directly to the doctor who's actually signing the orders. So it won't go back to 15 or 20 or 30 or anywhere else. It'll come back to us so that we can then take that information and get it out to the health officers in those local communities where the tests are positive, and help us then really be able to start to put the map together that we really need. So that's where we are with that. Dave?
2 questions.
Okay.
when you add bingo halls, my mother and her crew are going to these bingo halls in numbers.
Well, if we didn't write the word hall or bingo hall, we will definitely add those words. But we did say places where you assemble, 250 or less. We asked you to social distance. So I don't know how you can play bingo around a table and have a minimum of a 6-foot separation and play bingo. So if they can't do that, then they're violating what I put out.
And the second thing, daycares. What are we doing about daycare?
So that I kind of left up to the operators themselves. Again, social distancing, isolation. If they're able to and I'll certainly let the health professionals comment if I'm not going in the right direction. But for me, it was about them being able to make sure that they can adhere to the CDC guidelines. So if a daycare has 3 people and they can separate them and not allow the contact, I would say that would be all right. So again, I don't want to say I'm going to shut down daycare centers if they could actually perform what they're doing and meet the guidelines, because they're helping us then with childcare and other things. Because one of the concerns that I got called about from some of the leaders and from the healthcare industry is, county exec, you got to help us with daycare. Our healthcare workers don't have a place to have their kids, take their kids. You at the county level got to help us. And we are. We're working with our human services department on putting something together. But that is a critical piece that the healthcare industry has come to me with.
County Executive, I was curious also about some of the measures imposed by TNEC on stores. Obviously, one of the major economic engines in this area are the malls. And I realize that one mall is already shut down,
American Dream.
What are you anticipating any kind of limits on access to some of the large malls, Paramus and elsewhere?
So you know where I live, right? I've had conversations with the mayor on a more than daily basis. What I've said to the mayor of Paramus is be prepared. As I've said to Mayor LaBrosse from Hackensack for Riverside Square, be prepared. As I've said to the few other mayors that have mall-type structures, be prepared. So, to answer your question, it is in the plan. When that is enacted will be dictated by what we see from a spread or a spike. So if the spread gets so big, we're going to take action across the county. If we have a spike in Paramus, something like TNEC, then there's a plan in place for Paramus. And I will tell you that there's nothing off the table in regards to that.
Considering everything that has been discussed this morning, I know Dr. Fauci is also getting the same question with NIH. Would it be prudent just to shut everything down for 14 days and then reconvene after that instead of progressively working into different...
I'll let the medical expert talk about that.
I'll reemphasize what I said. We're not stopping this. So if we shut everything down for 14 days, first of all, I don't think it's possible, right? As a society, we cannot do that. And we're not going to stop this. So at Holy Name, we're taking it a week at a time. And my guess is 14 days may not be enough, right? So if we stop everything down for 14 days and they get a false sense of security, that doesn't work. So a week at a time for us at Holy Name, that's what I'm strongly recommend everyone else does. We are probably going to be in this for months.
All right, I think we've answered enough questions. I want to thank you all. I will tell you that I'll keep putting out press releases, so you know what's happening. I will tell you, be prepared for in probably the next day or two for another press release. All right? Thank you all.
Thank you, guys. Thanks, Jim.
Thank you, guys.
Thanks, Josh. That microphone.